We're thrilled to have all of you here. As I mentioned earlier, Jana had a couple of things come up last second, so I'm here in her place. You're stuck with me for the beginning, but I'm thrilled to be able to share this little bit of time. And for myself, I've like I shared a little bit ago, I've been in Canada for quite a few years now, and I've been in sales my entire professional career. I have entertained network distribution in the past and done very well. Traveled all over 4 continents as a trainer for a company in the 90s, and I've done a lot of conventional work since that time. Jana got a hold of me, gosh, it was over 2 years ago now, to share a product with me, and actually it was because of the gentleman that you're going to hear this evening and his credibility, his little video clips that I listened to intently, because my entire family's white collar, that got my attention. And I'm so glad that that happened, because the product that he's going to talk to us about this evening has changed many people's lives. For myself, when I queried Jana about what she was doing, when I have to tell you that I was getting up at 3 o'clock in the morning to go into Vancouver every day for work. And somebody, I have to ask everybody to mute themselves, please. If you haven't muted yourself, could you do that for us? Thank you. Appreciate it. Just make sure your little microphone's axed out. So I'd get up at 3 and drive into Vancouver, and around 2 o'clock every afternoon, lo and behold, I would hit a wall because I was overtired. And when I started taking Emlyn, that stopped, interestingly enough. So a lot more energy than I'd had previously, and I was extremely thankful for that. And my story with Emlyn is kind of minor in the majors next to many other people's, but it wasn't for me, that's for sure. At the time, it was life-saving for me at that time. So I'm going to ask one of my other colleagues here to come on and be live for a second to share his testimonial with us, and that's Brian MacArthur. Brian?
Hi, Nannette.
How you doing?
What happened to me is I fell when I was in New York City. Dr. Ahrens was there, and I broke my left arm about 1.5 inches down from the shoulder, and it was a complete break, my whole arm. There was 5 chips, and there was also from the bottom part of the bone break, there was a piece of bone that split away from the arm about 1/3 of an inch wide and about 2 inches long, and it stuck out from the bone about 1/4 of an inch. And when that happened on a Saturday evening, I didn't get back home to Prince Edward Island until Tuesday afternoon. And I went to my doctor the next day and went to the specialist, and they took the x-rays and everything. Now, I was taking Emulin at the time, and my regular dosage of Emulin at that time was 2 pills in the morning and 2 pills at night, because I was overweight quite a bit. I was about 240. And when I got hurt, Dr. Joe said, up your dosage, so I did. I went to, instead of 4 pills a day, I went to 12 pills a day, because it's an anti-inflammatory. I took 6 pills in the morning, 6 pills at night. And when I went to the doctor on Friday, the specialist, and the first thing he said to me was, we're going to operate, we're going to put pins in, and we're going to put screws in the whole thing. And I said, no, I hate pain to begin with, and I didn't want any more. And he said, what I'll do, I'll put a cast on and I'll leave it for 2 weeks and we'll see. But he said, I'm almost positive that we will be operating at that time. And what he did, he took me into the room and they put the sock on over my arm and then softened up the cast, got it hot, heated up, put it on my arm. And he said, now this is going to really, really hurt, because I have to, that bone that was sticking out from the arm, I have to grab that and with the cast and everything and move it back so that it goes back into alignment with my arm. And he said, you're really going to feel it and it is going to hurt. And it's going to take about 8 minutes. So I just gritted my teeth and he did it. And when it hardened up enough and he said, okay, I want to see you in my office. And he was looking at me kind of weird. And one of the nurses said, when he left, he said, you never yelped or you never yelled or anything. And I said, no. And she said, I've seen men in here with that type of a break literally crying when he did what he did to you. And she said, what, are you that pain intolerant? And I said, I never felt any pain when he did that. And basically with the Emlyn, that I feel, and in talking with Dr. Joe at different times, that the anti-inflammatory, it took all the inflammation out of it. It is also a pain reliever. And the doctor, when I talked to him 10, 15 minutes later, he just said, what are you taking? And I said, I'll tell you in 2 weeks when I come back. And I went back in 2 weeks and they did the x-rays and everything. And he said, we're not going to have to operate, because he said, your arm should be taking between 3 and 5 months to heal. He said, the way it is going right now, within 2 months, it'll be completely healed because the inflammation came out. And he said, the bone is restructuring and the whole thing. He said, I've never seen anything like it. And it had to be, the only thing that I was taking differently was the Emlyn. And it's a godsend and a lifesaver for me, believe me. And it also helped I'm a type 2 diabetic, and it has helped control my blood sugars too. So thank you, Dr. Joe, big time.
Thank you, Brian. We appreciate it.
Yeah.
So I'm going to give a very, very brief introduction to Dr. Joe, because his mom's not here today to give the best one, but he just came off of travel, so we appreciate, Dr. Joe, that you're here with us. He has been working on products for many, many years. He's an actual real scientist, and he's ours, thankfully. So without further ado, I would just like to introduce Dr. Joseph Ahrens, and I think he's coming to us from someplace south of Florida. Am I right?
Yes, today I happen to be just south of Orlando. I just got back from China, and I'm a little groggy, so I hope you'll bear with me. And also, it's raining hard out here. We might have a little communication issue. I hope everybody can hear me fine.
We can hear you fine. We can hear you fine. Good.
I'll be back tomorrow at home. I basically live in the Bahamas, so, and that's my home. I'll be there tomorrow. And so I'm not in my office that you people normally see me in, but this will work. Here at my granddaughter's house, I get to stop by and see her every 2 or 3 weeks. But I'll tell you, she's on Emlyn. I actually made her breakfast this morning, and her mother said, don't forget to add in that Emlyn. So I broke open a capsule and gave her half a capsule worth right onto her breakfast. So her mother has got this 4-year-old on Emlyn because, you know, it's my own family. You know, that's something, wow, you see all these drugs advertised and it says, okay, now be sure if you have suicidal thoughts, you want to jump off a bridge, or, you know, if you have a heart attack or something, be sure to let your doctor know. Well, none of that stuff for us. I give this stuff freely to my granddaughters, my children, all of my loved ones, and actually even Brian MacArthur takes it also besides my loved ones. I like to let you know that. Brian, you didn't tell the story that you actually tried to claim you were mugged and collect insurance there on being mugged, and unfortunately with that broken bone, but
it didn't work.
It didn't work, but you know, the outcome was the same way. But you told me, how did we know that this was Emlyn? I said, well, we have to break your arm 3 more times to make sure it was legitimate, because in any scientific test you have to have 3 trials. So
and he said that with a straight face too.
Well, it's because I mean it. So when you're completely healed, come by and I'll break your arm with the baseball bat and we'll try to see how that's going. But with all kidding aside, you know, people do tell me things just like you did, Brian, that, well, I had a strain or in my ankle, or I had a busted kneecap, or I was supposed to be in a cast for 3 months and I'm 6 and 8 weeks, it's healed. Or I was in a wheelchair. I've had arthritis for, you know, 10 years, and all of a sudden I get out of my wheelchair and no more asthma, no more psoriasis. So what is going on with this product? Well, you know, I want to tell everybody, and everybody has to remember this. This is our motto. Emlyn does not cure anything. Emlyn does not cure disease. It doesn't mend your bones. What it does is mend your immune system, your healing system, and the way your body deals with sugars. That's the two things it does. It manages sugars and it manages inflammation. It is just like we discovered a new vitamin. This is a new vitamin. And if this was 1990, we'd be calling it a vitamin. But because of the way the laws have changed, we say we have discovered a vitamin-like compound. Yes, this is a vitamin. And it is essential for your immune system to work. And in an ideal world, with the proper diet, you wouldn't need any of this Emlyn. It would already be in your diet. And everybody would get their broken bones healed in 6 and 8 weeks. And everybody would no longer have psoriasis and asthma and arthritis, all these inflammatory related diseases. That would be the true normal. But we don't, and have not had these components, these natural food components. We've not had them in our diet for thousands of years because of how we have just bred our plants, and there's no more in there. And also, when it is in there, as soon as you process the food, like making raw sugar cane, sucrose, table sugar, when you process that into pure white crystalline table sugar, it removes all the last trace of it. So we're just not getting enough. And just like if you did not have vitamin D, your bones would fall apart. And if you did not have vitamin C, you'd get scurvy and your teeth would fall out. You put back in vitamin C and you become healthy. Put back in vitamin D and your bones are strong. Put back Emlyn in your diet and your whole immune system is working how it should work. That's what's going on, people. This supports and is necessary for your immune system to function. And a lot of people don't quite understand, well, what does it mean, immune system? Well, immunity, the inflammation is the first step in healing. Whether it is a perceived poison like refined table sugar, which we take in all the time, or whether it's a bee sting, or whether it's a cut or a broken bone, the first thing that happens is inflammation, and that is very healthy. That's the beginning process of your healing. Inflammation comes on, and you've got a little general in there that directs all the little troops in your body, and it says, clean that up, heal that, attach this to that, get rid of the poisons, the inflammation, the bee sting, knit the bones back together. But if that system is not managed properly, it goes berserk. And it ends up with your body having constant inflammation, and constantly it ends up attacking itself. And it causes several things. For things like broken bones, it takes double the time to get healed. For things like poisons, you get on a constant low-grade inflammation. Like taking in table sugar, your body thinks it's a poison, and you're constantly under a low-grade inflammation, and your body actually starts destroying itself. And that, for instance, is what rheumatoid arthritis is. It's your body destroying its own joints. Psoriasis, your body is destroying its own cells. And we see it on our skin when we have skin psoriasis, but actually psoriasis can be on your internal organs also. We just don't see it. With Emlyn, your inflammation is managed. Your immune system is managed, and it operates efficiently, and therefore your bones heal like they should, which is half the time of normal. Your sprains go away. Arthritis goes away. Your asthma can go away. Psoriasis, all of those things go away. Also, diabetes is part of that process. You've taken so much refined sugar, your body thinks it's a poison. You go into constant inflammation, and ultimately your body starts destroying how the insulin works with your body. Take Emlyn, everything is managed properly and performs how it should. So we say that Emlyn is like a vitamin. Everyone should take it. Not just people with broken bones or diabetes or asthma, but everybody, even the most healthy human on the planet needs Emlyn. I tell everybody that, you know, Serena Williams takes this product, and she thinks that that's what gives her that top edge. It lets her perform at her optimum. So Emlyn allows your body to perform at its optimum, and your body can do amazing things when it is running on all cylinders. That's really the story here. Emlyn's a vitamin. Everyone needs it.
Thanks, Dr. Joe. Could we take a few questions?
Yeah, sure.
Okay, thank you. All right. There's a lot in the text chat that are a lot of stuff. So I'm going to try and riddle through here as best I can. One lady has asked if she's got someone that's just had a stroke. Emulin, she's presuming, can be taken in saturated doses for how long?
Well, you really can never oversaturate yourself. You take as much as you can. You know, we're guessing. It's a scientific guess, of course, and everybody weighs a little different, you know, from children below 100 pounds up to people like Brian McCarty that weigh 450 pounds. We just guess an average of 2 to 4 is a normal maintenance dose. But if you have an issue that you're dealing with, diabetes or a broken bone or something, bump up that amount of Emlyn, and your body will use as much as it can. Take 6 or 8 caps, doesn't really matter. You cannot overdose. What your body cannot use, it will eliminate through the urine. So there's no way that you could overdose on Emlyn. It would just be, you'd have to take like 5 bottles a day to get anywhere near a dangerous level. So don't be afraid of it. If you have an issue, take a lot. And how long? Take the saturated dose, whatever you decide you need based on your weight, 6, 8 capsules a day, until you think that issue is under control. Then drop back down to a 2 to 4 based on your body weight, how much a maintenance level every day. So take 2 to 4 based on your body weight as a maintenance level. Everyone needs it every day. You know, my granddaughter, she takes half a capsule a day because she just weighs, you know, she's only weighs 40 pounds. So, and have an issue, take a saturated dose. As soon as you feel it's under control, if you're a diabetic, as soon as your blood sugar levels go down, then just take 2 to 4.
Thank you. Can Emulin relieve sciatic pain associated from the back down through a person's leg or shin area?
Yes, absolutely can. Problem with pain, a lot of different types of pain, chronic pain, neuropathy. Emlyn will cause your immune system to operate how it should, and therefore your whole nervous system and all your synapses, where the signal goes from one nerve to another, that becomes much more efficient. And the problem with some of this type of neuropathy, that type of pain, chronic pain, is it has a kind of a firing over and over and over. It's out of control again. And so Emlyn will come in there and stabilize that and set it where it should be. You should see much reduced pain, and that includes all types of pain, including migraines. You can actually get rid of migraines with enough Emlyn. It is not optimized for that. We have a product coming out in the future to optimize pain relief, but it absolutely will help. You can just look on all of the testimonials, and people say, I've had pain for 30 years and it just goes away. Again, it didn't cure that issue. It just put your body back where it should be, and your body then no longer performs improperly, the nerves start firing appropriately. Also, even Parkinson's is not particularly a pain, but it's still the nervous system that's not firing properly. It kind of stutters. That's what's happening with Parkinson's. Actually, the insulation on the nerve fibers is just like an electric wire. In Parkinson's, it has dissolved. Your body has attacked its own nerve insulation, and it dissolves. Take Emlyn, that stops, and Parkinson's even gets greatly controlled. So yes, it can help with that type of pain, but I want to remind you, whether you're having pain or not, everybody needs Emlyn.
Thank you. Our next question. This person has someone who they know that was recently diagnosed with MS and understands that possibly Emlyn could be of help. Do you have any success stories and or comments on how it might?
Yes, we absolutely have had stories of people with multiple sclerosis that have been helped. Again, we get back to the basic concept that these type of diseases are an autoimmune problem. Your body starts attacking itself. There's no virus that comes in there that's attacking you. Your body just is haywire. We are constantly barraged with insults. And that doesn't mean, like I say, your mother's fat, not that type of insult. When a medical professional says insult, it means it's been attacked, either like from a bee sting or from a virus or environmental issues like radiation, pollutants. And everyone responds differently to these type of insults. Some person might end up with multiple sclerosis. People might get Parkinson's. Some might get diabetes. How we respond to these environmental factors is very individual based on our DNA. But the root cause is the same. Your immune system is out of whack, and your body is attacking itself. So let us get that under control, and you'll see all of these different diseases also lower, just like IBS, Crohn's disease. These are all have the same root cause. It's your immune system that is out of whack.
Thank you, Dr. Joe. Next question, menopause, especially hot sweats.
Well, I will also report that we have a great positive result of people, particularly women. They're the ones that suffer those hot flashes. Well, that's all a hormonal system that is, again, what is it? It's out of balance. It's hormones out of balance. Your body is kind of confused. It doesn't know what to do. We are, the only animal that has two different lives where we live to like 100 or more, and it's past our reproductive prime, and your body gets the hormones get out of whack, and the result is symptoms such as hot flashes and the whole thing. I'm sorry about that, but Emlyn will, first of all, be the best that you can be under those circumstances. And also, again, in the pipeline in the future, we will have products specifically targeted postmenopausal women, and also some for men's issues. But remember, everybody needs Emlyn. Without hot flashes, you need Emlyn.
Thank you. And what about, should multiple vitamin supplements plus vitamin D be taken with Emlyn?
Well, vitamin D is a really interesting one because the research is piling up that even myself in the Bahamas are not getting enough vitamin D. And, that comes from the UV rays of the sun cause some chemicals in our skin to manufacture vitamin D. We still don't get enough of it. I always tell people they should probably supplement themselves with vitamin D. As far as the other vitamins, the truth is probably most everyone is getting enough, but there's no harm at all in supplementing yourself with a multivitamin. There's especially females, and a lot of folic acid. But it's not going to hurt to do that. There's not going to be any contraindication. And whether you're using multivitamins or not, you need Emlyn. Emlyn should be in your multivitamin.
Thank you. Another question or comment and question. A friend of this individual's was diagnosed recently with stage 3 breast cancer, 1 positive node. What can she tell her about Emlyn? Should she take it now with all of her treatments? How can I reassure her it would help?
Well, we do know there's plenty of clinical evidence that one of the components in Emlyn absolutely will fight, reduce, resist cancer formation. And it does that specifically by regulating tumor necrosis factor alpha, if you're interested in that. And it's been shown to reduce several different types of cancers. Again, cancers come from outside stimulants, from whether they're viruses or radiation, all types of poisons in our atmosphere, in our environment. And Emlyn will help your body cope with all of those types of insults, those problems in our environment. And if you do happen to get cancer, it's been shown to fight cancer and reduce the development and spread of cancer. We do not claim that we cure cancer. We can't do that. We won't do that. But what we can say is people that have taken the components of Emlyn have shown reduced cancer cells. So even outside of that, everyone needs Emlyn. Now, as far as Emlyn and cancer treatments, Emlyn does such a good job at protecting you from radiation that if your physician has prescribed radio treatment to you, radiation, you should not take Emlyn during that time because it will render the radiation therapy useless. It stops the bombardment. So about a week, 5 to 7 days before you're going to start radiation therapy, you should not take Emlyn. Go ahead and take the radiation therapy. As soon as it's over, get back on the Emlyn. As far as the chemotherapy goes, you can take the Emlyn constantly because there's no interaction between the chemistry that's in the chemotherapy and Emlyn.
Thank you. Another one, a roommate of this person's had a heart attack and has 2 stents, also had a twisted kidney and is taking medications for both. What is your suggestion as far as him taking Emlyn?
Well, I think they should take 6 to 8 Emlyn every single day. It's been shown to greatly help with any type of cardiovascular issues, from your heart muscle itself all the way down through the capillaries. You get much better, healthy vascular health there. It just helps them be more flexible and stronger, and pass the right chemicals back and forth between your blood system and your organs. I can't say it's going to untwist a kidney, but what I will tell you is that with Emlyn, it will help you heal whatever your issue is. It will make it stronger. It will make you stronger. Kidney, it will actually help repair that and any of the micro wounds that were caused from that. On top of that, everybody needs Emlyn. You need to be healthy. If you have these issues, take Emlyn.
Thank you. Next question. Should one use Emulin C or Emulin M when a person has high blood pressure, please, and why?
Well, there is an Emlyn C and an Emlyn M, and let me explain the difference in those. Emlyn C was made to particularly help people with high blood sugar, because if you're concerned with high blood sugar and you want to reduce that, because high blood sugar leads to a lot of issues. It's the actually definition of diabetes, pre-diabetes and diabetes. And then once you have high blood sugar constantly circulating in your bloodstream, then that leads to other problems such as tissue degeneration and neuropathy, all types of issues. So if you're wanting to lower your blood sugar and that is your focus, take Emlyn C. That means C stands for control of blood sugar. Everyone else, whether it's high blood pressure or any other issue, should be on Emlyn M. So for the general public, everyone that's not concerned with just high blood sugar, take the M. If you're concerned, if your primary concern is high blood sugar, take the C.
Thank you. Will Emlyn help people with sinus conditions?
Well, it sure will. I know it's like an old song just playing over and over and over. Take Emlyn, take Emlyn. If you have an issue, you need Emlyn. If you don't have an issue, you need Emlyn. But it will help with sinus problems. Sinus issues are generally inflammation of the sinus cavities and the epithelial cells lining the sinus cavities. They're inflamed. They're under attack. That attack can come from outside, from the environment, or your own body itself. You'll find great relief by taking Emlyn. Why? Because it puts your body back where it should have been.
Mm-hmm.
And then you can deal with those issues. So if it's just something simple as a inflammation of the sinusoids, of the sinus passages, it will help. Or if you happen to be extra sensitive and it's being caused by an insult such as pollen or something in the environment, your body will know how to fight that without getting out of whack and start attacking its own tissue. Yes, take it.
Thank you. Doctor, can a person that has glaucoma take Emlyn without any sort of side effects?
Yes, that's true. I actually used to have glaucoma myself, quite severe, like a pressure of 50, and it will absolutely reduce the pressure. And even some people have reported me, as far as eye issues go, it helps the retina so that they don't even need reading glasses anymore. Emlyn helps your body perform at its very best, whether we're talking about your retina, your eye, the pressure, the intraocular fluid, or any other part of your body. It will optimize your body's performance.
Thank you. Can Emlyn help rebuild cartilage?
You know, when our very first test was with rats that did not have a functioning pancreas, so they were not producing insulin. They're type 1 diabetic rats. We gave them Emlyn. This was in the very early days. We were trying to figure out exactly the dosage and the ratios of all the three individual components. And these rats, their pancreas started to produce insulin. The only way that could happen is that it caused the beta cells to rejuvenate. So the stem cells are cells that have not yet differentiated into what they should be. Stem cells are the same everywhere throughout your body, but if they happen to be in your liver, they turn into liver cells. If they happen to be in your pancreas, they turn into beta cells. Emlyn appears to cause your stem cells to turn into the proper functioning cells, and therefore the ones that exist in your joints turn into what they should be, that is cartilage. We've absolutely seen x-rays of people that were bone on bone with no cartilage, and a month or so later they show their cartilage rebuilding, and this is because it appears that Emlyn causes the stem cells to turn into the proper cells, in this case cartilage.
Thank you. Can Emlyn help with osteoporosis?
Well, similarly, what's going on with osteoporosis? Your body has lost its ability to utilize calcium. And Emlyn, by directing the immune system and your own body's functions, the inflammatory system, it will cause the calcium to be able to be incorporated into your bones, and your bones then are no longer as brittle. So it's not, again, a miracle that this is happening. You know, my own mother-in-law, she'd roll over in bed and break her hip. That's how she used to be. And by taking enough Emlyn, she no longer had those issues, and she was able to get up and get about, no longer using even a walker. So it helps your body perform at its maximum. In that case, it's all about calcium utilization and metabolism in the body. It kind of supercharges vitamin D and allows it to do its work.
Thank you. Can Emlyn be put into heated food to get it inside of children who can't swallow pills, and does it lose any of its potency or effect if it's heated?
Yeah, it'll work up to 400 degrees Fahrenheit. So it's good. It's good in almost all instances. You could bake it in cookies and breads, just remember that, around 400 degrees.
Okay. Can you address quickly again anything specific for Parkinson's, Dr. Ahrens?
Yes, we've seen people that had Parkinson's, and I don't know that we have completely eliminated it in all cases, but greatly reduced it, 70, 80%. Parkinson's is a problem with the nerves misfiring, short-circuiting, as it were, and Emlyn helps your nerve tissue rebuild that insulation on the nerves so the electric current doesn't leak out and misfire.
Thank you. What about lupus? Can it help lupus?
Yeah, that was one of the very first cases. Even before we knew what Emlyn was, we knew that it was in grapefruit. And we were able to take a grapefruit extract and treat lupus. It was very interesting. We did a kind of commercial, an infomercial way back, probably in 2007 or so, 2005. And we had this grapefruit extract, but we had not identified the Emlyn components yet. We just had the concentrated grapefruit extract. And the person giving the presentation, who was the host of this infomercial, had lupus. And she heard us talking during the infomercial. She was learning while they were interviewing us. She started taking that grapefruit extract, and while we were filming over the 2 weeks, it knocked her lupus out. It was amazing. Wow. That is one of the things that started us onto this discovery, saying we've got to identify what that is so that we can concentrate it even more and offer it to the public. And that was the very beginning, knocking out lupus.
Wow. That's a good one. What about back pain, such as caused by a herniated disc?
Well, my own daughter has these issues, and this is why she's particularly on Emlyn. And she finds out if she goes without Emlyn just 2 or 3 days, her back troubles just resume. Her body goes back to its same issues. And in her case, it's all about her back. And she has not herniated disc, but she has that synovial fluid that builds up in there, which I think was what you're talking about. And it causes her body to be able to manage itself. You know, it's just like if I was constantly slapping you in the face, constantly, 24 hours a day, eventually you couldn't do anything. You couldn't think, you couldn't eat, you couldn't sleep. Well, Emlyn gets rid of that constant inflammation and then lets your body heal itself. So especially in the back, it's been shown over and over to reduce those back issues.
What about celiac, Dr. Joe?
Yeah, you know, that's another autoimmune problem along with Crohn's and IBS. It's really an inflammatory issue. And your body becomes extra sensitive to some parts of your diet. Emlyn will get your immune system, your inflammatory system back under control, and you'll see that those issues go away.
Thank you. Before we end, one more kind of on the medical side of things question for you, and then a couple more that just have to do with the product itself and distribution. This person says, my daughter just had back surgery, a microdiscectomy, decompression of the L5-S1 disc. She's doing awesome. And the surgery was a success in stopping her nerve pain caused by 2 car accidents. It's been a week and I have her taking 4 EMULIN a day. Is that good, or should we up it? Her incision is clean and not infected at all. And she gets her staples out on Thursday.
Yeah, I'd go up, 6 or 8. Emlyn absolutely helps you heal, whether it was from a surgery, even organ transplants. Parts of Emlyn, particularly the myristotin, have been shown to help with your transplant to take. It causes your body to accept the tissue that it should and reject the tissue that it shouldn't. It's just like a manager coming in there and telling it what it should do. So any type of surgery, I don't care if it was on your back or it was just got a tooth pulled, Emlyn absolutely helps you heal. It gets you back on track. Everything will work it'll work how it should have anyhow with it. So go ahead and take it until she's through with the wounding process. It shouldn't be long, 4 to 6 weeks, and then go back on a maintenance of 2 to 4.
Thank you. Okay, I lied. One more medical one. What's the recommended dosage for someone who has been diagnosed with prostate cancer?
Well, I would always stick to this kind of same formula, depending on your weight. If you're light or heavy, take 6 to 8 while you're having an issue. Get your PSAs tested, and as soon as your numbers start dropping back down, then go back to a normal dosage of 2 to 4 based on your weight. Now, what is that? We just had to guess on average weights. You can't have 5 different formulas for people of all different weights. We generally 1 capsule per 100 pounds. That's in imperial. 1 capsule per 100 pounds. You weigh 200 pounds, take a couple of capsules. That's on maintenance. If you have any issue you're concerned about at all, whether it's an ingrown toenail, diabetes, whatever the issue is, prostate issues, then take Emlyn. Now, I also say this isn't all you ought to take. I'd recommend people take other things, such as palmetto berry extract, things like that, to help you with any type of prostate issues. But everyone always needs to have Emlyn to begin with before anything else.
Thank you. And finally, comments and a question for you. If you know the answer, that'd be awesome. They're wondering about availability because the word's getting out about Emulin, and they'd like to know if Emulin C and M will both be available through Valentis, and how soon can they order more of it?
Well, we still have plenty of M and C in the warehouses, Valentis tells us, and I will tell everybody they just ordered several thousand more bottles, I think 20,000 more bottles of M to keep up with the demand. And Valentis, how they release those, it's entirely up to them. I know that they are increasing the amount you can order, but we will not run out. It's not an issue whether it is available or not. It's just trying to make sure that everybody gets a chance of getting Emlyn as we fill the warehouses up. We've only had this relationship with Valentis for just a few months here, a couple of months, I believe, and we already. And we gave personally, our company gave Valentis all we had in stock. And it was like 6,000 bottles. And at the same time, ordered completely new manufactured batches. The first batches are M, because we had already around 6,000 C's in the warehouse. And then we'll also come along with the Emlyn C. There should not be any reason to think that we're going to run out of Emlyn. I mean, don't get scared over that. I'm working right now on the labels for the new bottles, so I know that's happening, and it's just a matter of weeks before the warehouses will be completely filled, and we still have some in the warehouse.
Good, excellent. So I think, Dr. Joe, we've kept you longer than normal, and we appreciate you riddling off all that information for us. Everyone appreciates it more than you know. And hopefully we didn't take too much time of your family time while you're there in Florida. So ladies and gentlemen, I would encourage you to come to these sessions on Mondays when Dr. Joe's available for us, and come early because our seating is very limited, and come with your questions. The best thing to do is just throw your questions in the text chat as they come, and then as you can see, Dr. Joe's very happy to help us and answer any of the questions you might have. So thank you, everybody. Thank you, Dr. Joe. Thanks for being here with us, and have a good rest tonight. And everybody else, thank you wherever you are in the world. Thanks for being here with us. Have a good evening.
Thanks a lot.
Thank you.
Good night, all.
Thank you.
Have a great one.
Good night.
Bye-bye.
Take care.
Bye.
Thank you.
Thanks, Nannette. That was great.
Oh, I'll see you on my page, Alan.
Thank
Okay.
you. That was amazing. Really good.
Thanks, everybody.
Thank you.
Thank you.
You're very welcome.
Thank you, everybody.
You'll get to see the pretty blonde again next week, I'm sure.
Thank you. The lenses.